Okay, on to the oblique and rectus muscles. We have the internal and external intercostals, which lie between the ribs. They elevate the ribs. We have the, if we go farther down in the abdominal region, we have the internal and external obliques, along with the transverse abdominis. So our layers go transverse abdominis, internal oblique, external oblique, and on top of that we have the aponeurosis of the external oblique, which is a sheath that runs around the top of the muscles. We have in the middle, we have the diaphragm, which is our primary muscle for inspiration. We'll move back up to the chest, and we have many muscles there. On the anterior portion, we have the pectoralis, which is our pec muscle, that is used to depresses and protracts the shoulder, rotates the scapula in the glenoid cavity, moving it downward. It can also elevate the ribs if the scapula is stationary. We have the deltoid that covers the shoulder. It is used in the abduction and flexion or extension of the shoulder. So when we move our arm out and we extend our shoulder this way or back in, that is using the deltoid muscles. We have on top of the ribs, we have the serratus anterior. Let's turn our skeleton out here. On the back we have some of our largest muscles. We have the trapezius, or the traps, that runs down kind of in a big V shape. The trapezius elevates, retracts, and depresses or rotates the scapula up. It can elevate the clavicle, and or it can help to extend the neck. We also have the latissimus dorsi, which runs on underneath the traps. It is most notably our swimmer's muscle. The latissimus dorsi extension is used in this extension, adduction, medial rotation of the shoulder. So when we extend, when we bring the shoulder back in, or when we rotate the shoulder forward, that uses the latissimus dorsi. We have the supraspinatus that runs underneath the trapezius, underneath the scapula. It's used also in the abduction of the shoulder when we move out. We have the rhomboid minor and the rhomboid major that both adduct the scapula and help to perform downward rotation. We have the levator scapulae, which is up in the shoulder that runs down to the scapula and it elevates the scapula. We have the infraspinatus, which is underneath the runs underneath the deltoid and the trapezius. Next, let's move down the arms. The shoulder is a ball and socket joint. On the anterior portion of the arms, we have the biceps. On the posterior part, we have the triceps. They're appositional muscles that produce flexion at the elbow and the shoulder. The bicep is used for supination when we roll our arm outward. The triceps also extend at the elbow and adduction at the shoulder. Running from here down to the radius, we have the brachioradialis. It provides our flexion at the elbow as well. In the forearms, we have the palmus longus, which provides our flexion at the wrist. The pronator teres runs across the elbow here and allows us to rotate the elbow in pronation and supination. The pronator quadratus is a band that runs across the wrist and allows us to pronate the wrist. We have the flexor carpi radialis, which is also in the forearm, which produces flexion and adduction at the wrist. Our elbow is a hinge joint while our wrists are ellipsoid joints. We have the supinator that runs on the other side of the elbow across from the pronator teres, which allows us to move the arm in supination. We also have the flexor carpi ulnaris that runs in the forearm, and it also provides flexion and adduction at the wrist. So I move the hand away or I pull it in.